When my stroke started, I was at home. It was in the middle of the night, and I had gotten up to use the restroom. My name is Mary Dunsmore. I'm 43 years old. I live here in Atascadero with my family, my husband, and I have twin boys. I teach 5th grade, and I actually had just gotten back being a chaperone for their science camp trip when I had an ischemic stroke.
She had a look as though she was confused. It was really unusual. And here it was, it was the middle of the night essentially. I was asleep. And, when she came back to bed, I looked at her and I said, "Are you okay? Everything okay?" And she just had a very unusual look on her face, as though she wanted to talk but couldn't. And she kept motioning to speak, but nothing would come out.
It's hard to really explain what you experience because you really don't feel like something is wrong or even that something is different. I knew I couldn't speak. It was almost like I was trying to say a few words on the way to the bathroom and I couldn't, so I knew that I couldn't speak, but I could walk, I could think, I could hear everything. I wanted to go back to bed, and I felt in my logical mind that I would be able to speak in the morning and it will be okay. And luckily my husband kind of knew better and knew what to look for.
Our patient arrived to an outside medical center with a severe aphasia. That means that she had difficulty primarily with language. I'm Robert Taylor. I'm a vascular and interventional neurologist. I practice at the Stroke and Neurovascular Center of Central California.
I'm the medical director of Stroke and Neurovascular Center of California. I'm in practice now for several years, and I came to Santa Barbara 8 years ago, moved from the University of Miami to build a neurovascular practice. There was a true need. As the larger universities are quite far away, such as the universities in Los Angeles or up in the Bay Area. So I felt always that patients in this region don't get the right treatment on the right time. And clearly this expertise was missing, and that's what we had focused on over the past years to build up a more regional service that involves neurovascular patients, stroke patients, who had a brain hemorrhage from an aneurysm, carotid artery disease, or some vascular disease that may involve the spinal cord.
So in this particular patient, we used a stent retriever called the Trevo device that grabbed the clot and pulled the clot out on first pass. We achieved a complete recanalization in our patient within a very short time.
I remember the nurse talking to me, and I was kind of a little bit hesitant because I knew I couldn't talk before, but I was able to talk right away, and this was just within hours of having the procedure.
I was so relieved to get that call right after the procedure to say that Mary was going to be okay, that the procedure was successful, that the stroke had been cleared, and that he expected a full recovery, and that was amazing. So happy that I was able to recognize that it was a stroke and make that decision in the middle of the night instead of just falling back asleep like most people might do.
My life today after the stroke, I'm very grateful. It could have been really different for me if I still wasn't able to walk or talk, or, it can be life-altering. And by having the procedure I had, I was able to have my life back.